Theresa Fraser. I am honored to be a Lowenfeld trustee, and in this video, you're going to be able to listen and witness the conversation that I've had with Susie Wolf, who's also a trustee. Enjoy.
She has graciously agreed to meet with me to talk about her experience in the Sandtray community and the history of Sandtray from her experience. And I'm just so grateful to spend time with her. So, hi, Susie.
Hiya.
Hi. So Susie's in England, I'm in Canada, and we're connecting. And I thought it would be really, I met you as also a member of the Lowenfeld Trust and I'm just so grateful every time you talk about your experience because this is history that others want to know. And it's really interesting as a Sandtray therapist to hear what your experiences were. So I thought we would just do an intro of how did you get interested in Sandtray in your career, and who are people you've met along the way that have supported you?
Okay, well, I think originally I saw the book, the Virginia Axline book. What's it
Me
called?
too.
What is
Jibs
it
in
called
Search of
again?
Self.
That one.
Yeah.
And I was inspired by it. And I thought, wow, this was a long time ago. I mean, I must have been 20, something like that, maybe a bit older. And I thought, wow, this is really interesting. And I think I'd like to work in this way.
Wow.
And I had been working in a mental health setting in a large psychiatric institution as a social worker, but that it wasn't really the right thing for me. And then there were lots of issues attached to that. I had a long way to travel, and as this the way of working, it wasn't right for me anyway. So then I didn't know what to do next, and then I worked on a magazine called
Really?
Good Housekeeping magazine. Do you want to know all this early stuff?
Yes. Good housekeeping. I remember Good Housekeeping.
Yeah, so I worked on Good Housekeeping magazine, and there was the section I worked for was called the Family Center.
Right.
And the woman with whom I worked, whose name was Jean Shapiro, her husband was a very eminent psychologist who worked in the Maudsley Hospital, which is one of the big psychiatric
Right.
institutions. I got the job in the first place because of my mental health kind of background.
Right.
So we did lots of things, like we did features on families, and we'd answer readers' problems, usually to do with family connections, things like that. And I was thinking, should I go to be a journalist or something else? And then at one point, when I was about 15, I'd also first thought about becoming a speech therapist, as we
Right.
were then called, now called speech and language therapist. And we were doing an article for the magazine on speech therapy. And I thought, oh, I remember this. This is what I wanted to be when I was 15 or whatever. And, things pass by and you don't do it at the time.
But they
Um,
circle back, don't they? It's like
yeah.
hearing your story, it just reminds me of that. It circles back.
So I went to visit a few speech and language therapists doing their work. And I went and met, oh my goodness, a psychologist whose name escapes me, who's done a lot of work with children with autism. And I thought, oh, this is the thing then. So I thought, right, I'm not going to do journalism, I'm going to do speech and language therapy.
Wow.
So I applied to train, and I was by now about, let's say, 23-ish. And I applied to Central School of Speech and Drama, which at the time had a speech and language therapy diploma course.
Right.
That was it. I loved it. So I
Wow.
did that, and then worked with kids of various kinds, lots of children. I worked with adults as well for a while, people who'd had strokes and so on. And then I also was teaching at Central School after I'd qualified, and for a bit. I did a master's in phonetics, which is,
Oh my
uh,
goodness.
yeah, at University College. And then I went and I taught at Central, plus I had a job at what was then called Paddington Green Children's Hospital. Worked with a great team. Then I worked Charing Cross Hospital with the child development team there. And then I got a job teaching at City University. In the interim, I'd had my daughter as well
You're parenting and then working
in
on
the
all of this. Oh my
AUTs.
goodness.
And then I thought, so I worked teaching at City, and then just one day I was reading a journal, and in the back of the journal was this advert for a course in Margaret Lowenfeld projective psychotherapy, I think it was called at the time. I thought, oh, this is what I want to do. And this is, we're cycling back to Axline and all of that stuff
Yeah.
then.
Yeah.
So I got in touch with Therese Woodcock, who was running the course,
Wow.
and applied and got the place. And this was now about 1990 something, 7
Wow.
maybe. Did the course. And then following that, I did the course. And as part of the course, I had a clinical session that I was doing as part of my teaching work at City University. So I kind of started using the Sandtray approach with the kids I was working with, because I thought this is just the best way of working with children who are maybe non-verbal or for whom verbal communication is an issue.
Right.
The Sandtray allows them to communicate much more effectively and show who they are, and the sensory aspect of it's great for kids who've got issues. Some children actually don't like sound when they've got sensory issues, but mostly they do.
Yeah.
So then and then Therese asked, I did the course, which was at the time, I think it was a year, but then it was running again, and Therese asked me to kind of be alongside her.
Wow.
So
Wow.
I spent several cohorts of just being alongside and then taking on some of the teaching and some of the practical bits and gradually picking it up. And then we wanted to develop a degree, a master's degree. And because that's what I, as part of my work as in the university and when I was teaching at Central School also, I've been developing degree level programs for speech and language therapists. So I knew what I was doing, kind of thing.
Our paths there's some similarity there. It just makes me smile. It's lovely.
It's funny, isn't it?
Yeah, and
But
also
then we'd entered into the Lowenfeld. I mean, this is all very truncated, my telling of it, but it all took a heck of a long time to
right.
organize, to make the right contacts. And we were looking for university to pair up with, to provide
Yes.
some of the teaching. Because
Yes.
what we were designing was a 4-year part-time master's program.
Wow.
And in the end, it was through Jasper Woodcock, who's Therese Woodcock's husband. He had a connection to someone at Middlesex University who facilitated the whole thing, and we managed to join up with them, and it was we offered it as a joint master's program with
Amazing.
Middlesex University. So that was great, and that started about 1999.
Wow.
But it ran for and I can't, just off the top of my head, I can't actually remember how long it ran for, but it was no more than about 6 years altogether. So that was a 4-year program, maybe 2 cohorts, I think,
Cohort
maybe.
students. Wow.
Not very many people. And so we were really thinking, well, this is not viable. We can't afford to run this. It was a time of people couldn't get time off work, and you had to, one of the criteria for coming on the course was you had to be working with children, and you had to have a background in psychology, teaching, something relevant. So we couldn't recruit people at the time, and this has been a play therapy problem. It's not just our problem in this country. I mean, I don't know what's happened to some of the other courses now, but I think some of the other ones are not able to keep running. So it's a problem for us, and
Yes.
it's a real shame because people are not being trained.
Yes.
They're certainly not being trained in Lowenfeld because there's nobody there left to do it.
Right.
Well, not many people, maybe 1 or 2, but not many.
That's why the Lowenfeld Trust is hoping to support training going forward, which is so important. Linda Hollmeyer, who's an American play therapist and well known in the Sandtray community, and co-wrote a book with Daniel Sweeney, a foundational Sandtray book. She says in her research as well that even before, like when play therapy gets cited in research papers or peer-reviewed papers, obviously Virginia Axline's work is cited consistently as like a seminal document. But she says that Margaret Lowenfeld, in her belief, is the first person to mention play therapy in her work. So
Yeah.
anywhere, but
Yeah.
we
And
don't
then,
hear
and it
that.
was
We don't hear
for a
that
while
often.
it was called child psychotherapy.
Yes,
And then it seemed to morph. I mean, Therese Woodcock she was a qualified and child psychotherapist because she did the training at the original Margaret Lowenfeld, place, and therefore, and she was a member of the Association for Child Psychotherapists, right?
yes.
To which she clung very strongly.
Right. And in Canada, when I was first certified, we called it child psychotherapy, play therapy. And now it's kind of morphed to just play therapy with the value that play therapy and Sandtray as well doesn't just address the needs of children, but also people across the lifespan. And
Yeah.
that's really important to my work too, in terms of it isn't just little people, it's older people. And sometimes people are surprised by that. They're like, adults. And it's kind of like what you said when you were talking about people after strokes, etc. That another common reference is Gary Landreth in the States talks about toys being the words, and the play being the story. And
Yeah.
I mean, that's so true with Sandtray. So,
And it's so true with when I talk a little bit later about some theoretical stuff of Margaret Lowenfeld's theory of the proto system, that's something that goes through your whole life. So it's not something that stops just because you're grown up.
right.
It's there as a way of processing the world. But I'll get onto that later. But I think another issue for the course was we had problems getting validation for people as therapists.
Right.
There's a long political history there, and I probably better not go into it all. But anyway,
Oh, it's still going on around the world.
so yeah, I know, and so that was an issue because I was practicing on as a speech and language therapist using Lowenfeld techniques, right?
Right.
So I wasn't calling myself a play therapist.
Right.
So there's a problem there, and that's
Right.
been a problem. I mean, I don't know if it's still a problem. I don't even really know what courses are available at the minute here in this country.
Yeah.
Do you happen to know if the ones available?
No, it's a problem.
Yeah,
And that's why I was so excited when Oliver invited me to be on the trust, because that's I feel so strongly the teaching and the learning and the mentorship needs to keep going and go on.
yeah.
Because Dr. Lowenfeld's work like contributed so fully to what's happening, but it's not going to continue if we don't have the continuation of the teaching. So that's why it's so exciting. And in North America, when I first connected with Oliver, he was really surprised that there were so many people using Sandtray in North America with adults or with,
Mhm.
and there's lots of literature now where it's used with children, teens, couple. I use it in couple counseling, in family work, in group work. It's like such a transformational approach and intervention for all sorts, when you're working with kids who are selective mutes, like it isn't just, it crosses all ages of the population and lifespan, and
Yeah.
also helpful for all sorts of different issues. So, but we need to have, people are really thirsty for, excellent training. So, yeah, it's still an ongoing need.
Well, I definitely feel it's been a shame, really a bad shame what's happened, that we haven't been
Yeah.
able to get it more recognized or validated or whatever it is that needs to happen. I don't know why. I mean, I think what we offered as an MSc was very, very good.
Yeah.
You've seen it, haven't you? You've
I
seen
did.
our
I looked at it really quick. Part of my background too was working and doing degree development, which is why I was smiling when you were talking,
yeah,
because at the time I thought I'm getting off my path, because offering clinical work was my passion. But that experience, as a clinical like a curriculum consultant and doing degree development has then just enriched what I'm doing. So, and it's similar for you as well, that's been
yeah,
your path. That's why I was smiling. So I think
yeah,
but we're getting on there. Like these videos, there's going to be other ones added to the Lowenfeld Trust website with you kindly sharing your thoughts and lens on the theory. And and the Lowenfeld Trust is hoping to, we have some plans around doing some online training and then maybe some face-to-face training. And I'm excited to be supporting that
yeah,
because
that'd be great.